I'm so excited to go deeper and share how Nurture is pioneering prevention of postpartum depression using AI and clinically validated protocols. And I became very interested in this problem when my best friend experienced postpartum depression herself. And what I learned is that 85% of women are going through this. And just like her, they're falling through the cracks, not receiving care. And sometimes, like her, they're actually hiding their symptoms because they're afraid their child will be taken away. Given that this is actually the #1 complication of childbirth, with 1 in 5 women experiencing this, it's really shocking that we're letting it fall through the cracks so frequently. There's a 2x rise in the past decade alone, and this is costing payers 80 million per year on average. So this big problem is only getting worse. And part of the problem is that postpartum depression is such a misnomer. Guys, more than half of all cases actually start during pregnancy, which is why OBGYNs are the best positioned to catch it. But they're not mental health professionals and they struggle with existing tools in the very short appointment windows. We also have a reactive healthcare model that focuses on the postpartum checkup. But guess what? 40% of women even skip that checkup. So you simply can't screen a woman who's not at this appointment. So the reactive model is failing us. And it's also exacerbated by a shortage of behavioral health clinicians. Unfortunately, there's not enough of them to take care of the existing patients today. That's only getting worse. And this tells us that any solution in the space needs to leverage technology to make the existing clinician base more efficient and more effective. Guess what? That's what we're doing at Nurture. We are using AI to predict, prevent, and finally treat postpartum depression, starting with our universally accurate prediction model, leveraging AI to diagnose patients before symptoms appear. We then take our high-risk patients and onboard them into our preventative self-guided therapy based on a clinically proven protocol to prevent more than half of all cases. We tie all this up with a telehealth component that allows us to treat all the patients that do go on to need support and generate revenue for all parties. But again, that status quo is quite sad. Only 15% of patients today are receiving care. But with our revolutionary prediction models, multiple modalities I can really nerd out on, we're able to identify all these patients in advance using pre-pregnancy features. So we can tell you at that very first intake appointment with the OBGYN. From there, we take these high-risk patients and onboard them, introduce them to Naomi, who walks them through different protocols, teaching them resilience, outreach to network, challenging black and white thinking, all of these things that are clinically proven as a protocol to prevent more than half of all cases. We've broken it into easy and engaging content. We're in multiple languages, but most importantly, we're building a high-touch digital relationship with these patients so we can do more frequent mental health screenings. And as soon as they meet the criteria for any perinatal mood and anxiety disorders, we're now treating them with something called collaborative care model or other behavioral health interventions that are reimbursable and supported by the OBGYN. In this model, the OB actually manages the payer contracts and even does the billing on our behalf, allowing us to treat the patient with existing CPT codes. All of this lets the OB focus on their practice and also differentiates that practice in these crowded urban environments. But at the end of the day, there's also a revenue component. We're generating over $1 million per practice with 300,000 going back to that OB. So today the TAM is about 18 billion, but keep in mind that's only 15% of patients that are actually being treated and captured in this number. With Nurture and how we're able to open up this market to capture the additional 85%, we're looking at a 120 billion TAM, and we're uniquely positioned with our technology and language abilities to establish ourselves globally. We're starting with OBGYNs and able to generate about $1 million per practice, but we're very excited to solve expensive problems for payers and employers. The average payer is losing 80 million per year in downstream costs associated with untreated postpartum depression. It's the tip of the spear for your health in general during pregnancy and leads to higher NICU utilization, C-section, preeclampsia, and gestational diabetes, to name a few. And that's before we go on to the additional absenteeism and turnover we see in employers in the space. So starting with OBGYN clinics as our beachhead is really a strategy that allows us to get the real-world clinical data outcomes we need to sell into the payer space, where we have much larger revenues, more scalable, and bigger margins as we just focus on the technology component. So there's just a couple other plays in the technology space here, but we're the only ones doing early and scalable prediction, which allows us, again, to be the only ones doing prevention and really tackling value-based care. We're also the only ones doing integrated OBGYN, seamless billing, and existing CPT codes. But one way I like to think about it, other groups are just focused on a smaller market. We're focusing on the 85% and the 15%, allowing us to capture and own the patient from the earliest stages of pregnancy. Why do we care about this problem? I saw my best friend go through it when I was a nerd at MIT, so I had access to some of the best AI in the world. And that's what we did. We got mad about this problem, and we decided we would use this technology to predict, prevent, et cetera. We put together the best team in the space, academic researchers, et cetera. And we're really excited to share that we're patent pending globally. We're already strategically implemented on both coasts and have agreements for over 1 million that have been signed. But where do we go from here? That's the past. What I want you to think about is what's next. First of all, my background is sales, sold into every channel of healthcare with a history of 10xing revenue. And I just got joined by one of the best. Peter Baywin has overseen 250 salespeople in the cord blood space, which is a perfect one-to-one for selling into OBs with our unique model. We also have an exciting patient-driven demand opportunity coming up that we'll be sharing this fall. But we're raising $500,000 to act on this, and we need your help so that we can raise $127 million ARR by year 5, touching just 5% of pregnancies. So with that, I'm hoping that you guys will help Nurture to be the beginning of the end for postpartum depression. And thank you so much for your excitement.